Hey guys, this is your favorite new nurse coach here today, and I'm talking to you again about the number 4 reason that nurses can be held negligible when it comes to their license being reviewed by the review board or by the licensure board in whichever state that they are licensed in. So the number 4 thing that you can be held negligible for as a nurse is administering the wrong medication. Okay, so we know as a nurse you are administering medications multiple times per shift to multiple patients. So this increases your likelihood that you may have an error, but these are some things that you can do in order to ensure that you are not held negligible. Number 1, as you're taught in nursing school, go ahead and make sure you are implementing the 5 rights. Okay, right patient, right route, right dose. We know the 5 rights. Also now, if you recall, if you graduated from nursing school in the last 2 to 3 years, it's also the right documentation. So you need to go ahead and document correctly according to the policy standards, right? Documenting again the medication within the appropriate time frame, but also documenting if you held the medication and the like. So documentation is now a big part of the 5, now 6 rights for medication administration. So some things you can do in order to decrease the likelihood of being held negligible and or making mistakes is to verify the patient, verify the medication. If you work in institutions that have a where you can get orders over the phone, then you need to do a read back to the physician who's ordering and verify the information that they're stating. Also, according to the policies of the institution that you work for, it's important for you to assess to see if the doctor wrote for a brand name or if a generic name is also acceptable for that patient. Pay particular attention when it comes to anti-epileptic medications. For one, sometimes the generic brand may not work as well as the brand name, so it's important for you to understand the pharmacodynamics that happens with that and if it's appropriate for your patient. So verify these and much more things when it comes to medication administration, because you can be held liable. Like and follow for more. And lastly, I will give you the number 5 reason where you can be held negligible for anything that you do in nursing.